Hi, my name is Barbara Jones. What brings
Keep it
you
together, son.
Stop coughing. What brings you and your son here today?
Well, can't you see he's about to die? What you gonna do about it?
Have you been giving him any medicine for the past few days? Stop dying for a second.
Ma'am, where's your manager? You see my son is dying. I need some medication, please.
Oh,
I
I'm so sorry.
ibuprofen, all that medicine, and I need you to help.
Let me go talk to the doctor for a second. Oh my lordy Lou. Dr. Saggy Pay.
Yes, what can I do for you,
Another
nurse?
one of the patient files went missing again.
Are you serious? Gosh diddly darn it. It's always happening. How are we supposed to have good patient care when we're always losing these patient charts?
Man, can you stop dying already? Have some sense in here, please.
I am so sorry.
I'm dying!
I am so sorry, Miss Butticus. We lost your patient files.
And what you gonna do about it?
I don't know.
So what you expect me to do?
Speak to the doctor.
You know what? You know what? I don't need this. Come on, son. We gonna die somewhere else. Come on. We gonna get some other medication. See, you can't even walk straight because you couldn't give us our medication. Come on, now.
Just so they're gonna die somewhere else. Miss Afifidi,
Yes, Miss Bush.
our patient files are missing.
What's going on?
I'm not sure, Miss Afifidi Boo Boo.
You know what? I'm trying to get these numbers figured out. We keep losing revenue and I cannot figure out why. These reports aren't making any sense. The numbers are off. I just can't figure out what's going on. If we don't start seeing some changes, I will have to start cutting back on staff to keep afloat.
So what are you gonna do then?
Well, can't really pinpoint which department is the issue, but our charges have gone down, so has the money coming in. I don't know what to do to turn it around. I have so many reports to pull, but none of that give me all at least but some of the data needed. It's just too much.
Sounds like a lot.
Yeah. You can go to my office now. Take your stuff with you.
So what if I told you that I had a solution to your problem?
I'm listening.
What if I told you that there was a program that could essentially improve your quality of care, increase your productivity, give you better reporting? That way you wouldn't have to actually dig through reports and reports of nonsense. You can keep better track of your employees and what they're doing, improve your compliance so that you're actually meeting standards, and essentially get an increase on your return of investment. What do you think about that? Does that sound like a system that you need? You wouldn't have to worry about losing charts.
I think we have ourselves a deal. Epic. Wow. You know what? This just sounds epic. I'm in. I'm all in. Where's the paper?
Hey, my name is Jennifer, and I just wanted to talk to you a little bit about Epic. I have been in the industry for about 12 years now, and out of all the systems that I've used, it's probably one of the better systems, especially when you're talking about ease of use and productivity-wise, and just all the different capabilities that it has that, in my opinion, some of the other softwares don't necessarily merge as well. You know, obviously one of the key components of it is the clinical part, which when you're talking about documentation and being able, you know, to audit and just keep better track of, you know, patient volume that's coming in, being able to hold the doctors accountable for their charting, any missed, you know, opportunities of revenue, especially when you're talking about a revenue cycle, you know, part of it, you know, it's very simple, you know, it's simple but very effective in a sense where, again, as I stated before, you're able to keep better track of what's actually, you know, coming in and out, meaning, you know, what you know, what you're able to actually charge out versus, you know, the reimbursement. You know, again, from a revenue cycle, you're also able to break it down to the point where you can actually assign different work queues, so that you're able to hold each employee accountable exactly for their actions. So not only does it help you keep better track of, you know, again, of the money, but you can kind of see where your bottleneck is. So again, when you're talking about Epic, you're talking about a system that can essentially help you streamline so many different functions, so that your business is actually flourishing, you know, if used properly, right? Because essentially it's like any other system, you know, it's all based upon data that you put in. But you know, again, when you're talking about data security and you're talking about productivity and even, you know, simple things as patient engagement, you know, it does have a patient portal so that patients can access their information, along with various other things, make payments, and, you know, and again, it kind of keeps the patients interactive. You know, is there, obviously, you know, Epic is not cheap, you know, and it's one of those things that you have to factor in, but you also have to factor in, you know, you kind of get what you pay for, in a sense, where, you know, with Epic, you know, it has gotten to a point where you can, you know, you can send that patient's data even across different EHRs, to different practices that don't necessarily have to be within your network, which makes it a cool benefit also when you're talking about, you know, I guess that the portability of, you know, patient information. So in my opinion, you know, Epic is a great product, and I think that that it would be, you know, a great addition to Athens Regional Medical. And I hope you like our commercial.